So today we're talking about BiPAP. And what is BiPAP? A form of non-invasive mechanical ventilation using positive airway pressure through either a full or a nasal face mask without an endotracheal tube or artificial airway. Now, this is beneficial because it can be used on patients who are being weaned from mechanical ventilation, which can help them to get past the initial ventilatory crisis and avoid mechanical reintubation. So the benefits of BiPAP is that it helps provide non-invasive ventilatory support, which can help the patient to improve their ventilation and to overcome the work of breathing and improve gas exchange in asthma, post-op patients, and patients that are being weaned from mechanical ventilation. It also allows for, because the mask can be taken on and off the face, it allows for the patient to communicate, to eat and drink orally without having a mechanical ventilation, without having that tube down their throat. It also allows the patient to work to normalize their PaCO2 and PaO2 levels without risk associated with intubation, and it helps to avoid complications of invasive mechanical ventilation, such as ventilator-associated pneumonia or different problems with the airway that come with mechanical ventilation.
There are several indications for the use of BiPAP. Some of them include acute exacerbation of COPD, acute hypoxic respiratory failure, acute cardiogenic pulmonary edema, atelectasis, postoperative respiratory failure, severe acute asthma, and weaning patients from mechanical ventilation.
There are several masks associated with BiPAP. The first mask is a full face mask. There's a sizing guide to help you figure out which size to use on each patient. A medium is most common, as you can see here, on Emily. Then there's a total face mask. Oftentimes patients who are claustrophobic or the top piece rubs their nose too much and creates skin breakdown use this type of mask. Then we have a nasal mask. This is used when people want to be able to talk and drink and associate with the people around them. Then we have a nasal pillow. This is used whenever people are uncomfortable with the other masks or they just want to be able to wear their glasses.
So to set up our BiPAP, the first thing we're going to do is plug into an oxygen source, and we want to plug in directly to 50 psi oxygen outlet, and we don't use any gauges. Okay, so once we're plugged in, we also have to plug into an electrical outlet. Here. We use a red outlet, so if the power goes out, we're sure we have power. Then on the back, we just turn this little guy on, and it's covered up so it doesn't accidentally get bumped and turned off. The next thing we're going to do is set up our circuit. So we have a filter, we have the circuit, and then we have our masks. So the first thing we do, plug our filter in, and then we have our circuit, which we'll plug in here. And there's also a little spot for humidification if we were going to put in humidification and heat. So once we have that, we also have this right here, this clear plastic part connects to our mask on the front, directly on there, and then onto the pressure outlet. So this is where the air pressure will come in, part of this pressure will come in, and it's also one of the alarms to make sure that there's pressure connected to the system.
Now we're going to show you how to set up the BiPAP on spontaneous time. First, we're going to click monitoring. Then we're going to click the mode, change the mode. We're going to click spontaneous time, which is over here. Then once we do that, we're going to want to click activate the new mode. We're going to click parameters to change it. Okay, and now we're going to set our IPAP at...
IPAP is typically set between 10 to 15, and this support is the inspiratory, IPAP is inspiratory positive airway pressure. So this is the air that's going to blow in as the person is inhaling. EPAP is typically set anywhere from 4 to 5 centimeters of water, and this pressure is expiratory positive airway pressure, which is the positive pressure the patient's going to receive as they're exhaling.
We're going to set ours at 12/5. Then we would like to set our rate at about 2 to 5 below the spontaneous breathing of our patient. So we're going to set ours at about 10 for right now. Then we're going to set our inspiratory time. We'll probably set it about 0.9. The inspiratory time is the time it takes to deliver the required gas to the patient, and that gives you your I to E ratio. Then the next thing we can set is our rise time. This is mostly just for patient comfort. We'll probably set it at about 2 right now. The rise time is the speed at which the inspiratory pressure rises to the target pressure.
So the higher the rise time, the longer time they have to receive the pressure, correct?
Yes.
And the lower the rise time, the quicker that pressure comes in.
We can also change our oxygen saturation, but we're going to leave ours at room air for right now at 21%.
So when we're setting up a patient on BiPAP, the first thing we want to do, we don't want to just strap this straight on their face, because that might be a little claustrophobic and they're not used to that pressure yet. So we can take, Emily, do you want to take your glasses off? So the patient has to remove any glasses or anything on their face. We want to check her skin for any skin breakdown, and right now, because she was wearing her glasses, she has a little bit of compromised skin here. So if I was really going to put this on her and leave it on, we want to do something to pad that skin, maybe some gauze, and there's special things to put on the mask to protect the patient's skin. So the first thing we'll do is hold it up here, let her get a little feel for that. How you feel? Okay. So this is alarming just because the pressures are different, it's going off at us. So the first thing we do is we adjust the straps to fit from the top down. So I can get my patient to hold this and help me. So Emily, can you do that for me? So one of the things we want with this mask is we do want a little bit of a leak. You don't want this pressed right to their face. So I want to check that. This looks pretty good. I'm just going to tighten it a little tiny bit. Strap this on here, and go ahead and let go. So there's a lot of air coming out underneath her chin, so I might want to tighten this. Is it blowing in your face a lot? So what we want to look for is we want to watch for a tidal volume with our patient. So that is going to be the amount of air that she's receiving. So we normally give 8 to 10 milliliters per kilogram of ideal body weight. So say our patient is 80 kilograms, we want to give about 800 milliliters as the high end of the tidal volume. So we can see here is showing her tidal volume, her minute ventilation, which is how many times she's breathing per minute, her pressures, and we also want to watch for a leak. And her leak is about 66, so that's a good number. It's not too high, it's not too low, and it will vary as she breathes in and out. So those are all things we want to look for.
So there are a couple problems when it comes to BiPAP. One of the most common ones is tight straps, which create pressure sores. So since Emily's skin previously had a little bit of breakdown, I'm going to make sure and come back and check her every 2 hours. Some of the things I can do to prevent that is reset her mask. Is that a little better? And if it gets too bad or uncomfortable, I can just get her a whole nother mask. Like the total face mask. A little better, huh? And if she doesn't want that, or if it's not that big of a deal, I can always just get some of our wound tape, which helps prevent any further breakdown or any breakdown at all. One of our final problems with BiPAP is gastric encephalation. That can happen whenever you have your pressures too high, which are usually 20 to 25 torr. Whenever gastric encephalation happens, it's because your pressures are pushing the air directly into your stomach. This can result in nausea and vomiting, which can eventually lead to atelectasis or pneumonia.